The MotherWise program is part of the Prevention and Early Intervention component of the Mental Health Services Act. The goal of this component is to help counties implement services that promote wellness, foster health, and prevent the suffering that can result from untreated mental illness. The PEI component requires collaboration with consumers and family members in the development of PEI projects and programs. MotherWise began as an MHSA-funded program, and the MotherWise model has included the MHSA standards from the beginning through implementation in the program's own policies and approaches. Every contact potentially reduces stigma and incidence of perinatal mental health complications in the county. MotherWise also offers health professionals an important resource to refer moms who need extra support. The program has always enjoyed strong support and collaboration from the community, which continues to grow with the reputation. Cultural competence is extremely important to maintaining relationships with individuals and the different groups they come from. When MotherWise transitioned to a nonprofit business, cultural competence was an important factor in selecting their board of directors, and all program decisions considered known cultural factors. The program's ability to adapt is critical to providing the best possible service to mothers and perinatal individuals. Staff training includes instruction and practice with active listening and non-judgmental support, and team members are encouraged to integrate these skills into their daily practice. As moms themselves, staff can often see potential issues coming. Whenever possible, the program polls clients and encourages feedback and suggestions to understand how to better serve the community, changes to make, and why. Although the program is primarily focused on perinatal individuals and babies, MotherWise also supports dads, grandparents, and adoptive and foster parents. The program facilitates discussions on wellness and incorporates models compatible with other peer support groups, so moms in recovery, for example, can use experience from other groups to enhance their participation at MotherWise. Ultimately, the program supports perinatal folks who do their jobs as well as possible, leading to better outcomes for themselves, their babies, and their families. MotherWise offers consistent opportunities for social support to perinatal individuals in an effort to prevent or limit the severity of maternal mental health complications. Individuals receive support through weekly home visits with trained auntie volunteers, temporarily suspended due to COVID-19, in-person and online mothers groups, tangible items through the Mom-to-Mom Closet for pregnancy and postpartum use, connection to a network of the best local resources offered to perinatal individuals and families. Every individual that MotherWise reaches out to is underserved as perinatal mental health screening, support, and services are otherwise limited in Lake County. Mothers and perinatal individuals are engaged by the program through partnerships with community and health organizations, targeted outreach, and word-of-mouth recommendations. Each prong to this approach offers support along the pregnancy and postpartum road, meeting folks where they are at while simultaneously welcoming them to create their own individualized network of support, close to home. In addition, MotherWise specifically reaches out to perinatal individuals of the underserved transitional age youth, LGBTQIA+, and Latinx populations through inclusive community partnerships and outreach. Perinatal transitional age youth are introduced to MotherWise through referrals from community organizations and local healthcare providers that may identify a heightened level of risk, social media and word-of-mouth engagement, and targeted outreach that shares MotherWise's program activities with the community at large. MotherWise also reaches out to perinatal LGBTQIA+ individuals by recognizing that the pregnancy and postpartum journey are not specific to motherhood alone. Outreach efforts and social media engagement serve to inform the local community about the continuum of experiences that perinatal individuals have while simultaneously utilizing inclusive content that encourages folks to engage in screening and services whether or not they identify as a mother. Motherwise also reaches out to the Latinx community by utilizing bilingual staff to offer Spanish language services, including mental health screening, individualized social support, in-person and online moms groups, and tangible items through the Mom-to-Mom Closet. Program objectives: increased utilization of supports. COVID-19 reduced Motherwise's ability to conduct in-person outreach and education for part of the 2021 fiscal year. In place, the program worked remotely with other organizations like the Safe Sleep Class conference call offered by Sutter Health to talk about maternal mental health and connect with local individuals. Motherwise also utilized social media to target outreach and education to the program's over 2,400 Facebook followers and 1,792 online Mothers Group members. Improved scores on Edinburgh Postnatal Depression Scale. During the 2021 fiscal year, Motherwise offered remote EPDS screenings to program participants. Additionally, when services were adapted to an appointment-based hybrid model in April 2021, screenings were conducted in person during office visits. Repeat screenings were also given during subsequent office visits and were offered remotely during follow-up contacts. Individuals report feeling more supported after connecting with Motherwise. The large-scale impact that Motherwise makes is rooted in the individual interactions that the program has with every participant. These interactions demonstrate how individuals feel better supported after connecting with Motherwise. For example, during the 2021 fiscal year, one mom reported experiencing long-term postpartum depression after her first pregnancy. Upon learning that she was pregnant again, this mom reached out to the program for social support and was connected to a local therapist, community resources, and tangible items from the Mom-to-Mom Closet. She then offered feedback on her experience, stating, quote, "I kind of feel like my daughter is bringing me out of the depression. She has been super attached to me for the first time ever, and I've been so good with her. Thank you for your help and support. I really appreciate you." Unquote. The Motherwise program served a total of 1,414 individuals in fiscal year 2021. Of those 1,414 served, 1 was a child, 0 to 15 years of age, 329 were transitional age youth, 16 to 25 years of age, 978 were adults, 26 to 59 years of age, and 43 were 60 years of age or older. The Motherwise program served a total of 1,414 individuals in fiscal year 2021. Of those 1,414 served, 20 identified as Native American, 1 identified as Asian, 8 identified as Black, 2 identified as Pacific Islander, 288 identified as white, 31 had 2 or more races, 88 identified as Hispanic or Latino, 319 identified as not Hispanic, and 32 had 2 or more ethnicities. The Motherwise program served a total of 1,414 individuals in fiscal year 2021. Of those 1,414 served, 1,190 were born female, 9 were born male, 215 did not report their gender, 79 identified as female, and 1,335 did not report their gender identity. Program challenges. Motherwise is very dependent on financial backing of other agencies to serve its clients. As such, the program lacks a number of resources, including staffing, that could better support the program. In addressing this challenge, Motherwise made efforts to become a nonprofit organization and was granted 501c3 status in March of 2021. This change allows the program to seek additional sources of funding and legally accept the charitable donations necessary to adequately support a greater number of program participants. Key successes. Motherwise key successes during the 2021 fiscal year included operating remotely and then at an adapted capacity to ensure that all program activities, other than home visiting, were conducted safely. Mental health screenings were administered both remotely and in person, and specialized perinatal support was given to 492 individuals, a significant increase from the 97 individuals receiving this type of support during the previous year. 2 bilingual staff members were hired in the second half of the year. These staff members were able to develop relationships with 17 Spanish-speaking individuals and offered specialized perinatal support to them. Another key success was Motherwise's transition to 501c3 nonprofit. This change allowed the program to take on several grants, increasing operational funding for the next fiscal year. One of these grants, aimed at providing postpartum support international training to local providers and tangible items to Motherwise clients, was supplied by First Five Lake. The other will expand the program's Mom-to-Mom Closet activities and fund the hiring of an additional Mom-to-Mom Closet concierge staff member. Anticipated activities and number served. Motherwise anticipates serving 1,250 plus program participants in the upcoming fiscal year, as well as expanding staff contact and follow-ups to serve 500 perinatal participants. In the upcoming fiscal year, Motherwise plans to continue with current activities, slowly reinstate in-person essential services in both English and Spanish that were temporarily suspended due to COVID-19, add a mom-to-mom closet concierge position, and collaborate with other transitional age youth service providers to establish peer support groups for young perinatal individuals and mothers. Having received 501c3 status, Motherwise was able to successfully apply for a grant to fund the Mom-to-Mom Closet concierge position. Once funds are received, this position will be filled, adding another essential staff member to the team. Additional funding will then be sought to expand Motherwise services and moms groups to TAY individuals into the Clear Lake area. Spanish language services are also expected to greatly expand over the course of the next fiscal year. Screening services will be offered in Spanish, and specialized perinatal support is slated to reach a greater number of Spanish-speaking participants. Program outcomes. Monitoring for negative changes related to perinatal mental health by screening with the EPDS. The Edinburgh Postnatal Depression Scale was chosen as an indicator of negative outcomes, as it is a validated screening tool for depression and anxiety in the perinatal period. The EPDS can be offered in person, by phone, or online, and then scored by program staff. Changes in screening scores for those receiving support. EPDS scores can be tracked over time to monitor for negative outcomes. The EPDS can be given in pregnancy, within the first 2 weeks after giving birth, and over the course of the first year postpartum to monitor for changes, compare scores, and show general trends related to depression and anxiety. Staff can utilize these screening scores to individualize the support that is offered to each screened participant. Number of individuals who utilize the support Motherwise offers. Current year participants for each service offered within the program demonstrate need within the community and offer hints towards the overall prevalence of maternal mental health complications within Lake County. Number of individuals who report feeling better supported after connecting with Motherwise. Motherwise serves as a prevention and early intervention program by supporting expecting and new mothers before they begin to feel anxious or depressed, and/or as soon as it is indicated that they could use the program's services. Engagement occurs through a welcoming approach that encourages perinatal folks to speak up when and if they need support. Participants report feeling better supported after connecting with Motherwise, and this serves as a true indicator of whether or not negative outcomes are occurring and if the program is meeting its objectives. Anecdotal evidence and testimonials. The impact that Motherwise makes may be large, but the individual stories that demonstrate the support the program offers are just as important as the overall outcome. Staff provides individualized support to each participant in a way that meets them where they are at in their pregnancy and postpartum journey. Anecdotal evidence and testimonials also increase engagement as MotherWise's word-of-mouth reputation builds trust within the community and encourages mothers and perinatal individuals to seek out the program's services when and if they need support. Program outcomes. Results from previous fiscal year. Monitoring for negative changes related to perinatal mental health by screening with the EPDS. Changes in EPDS scores were difficult to track while in-person services were temporarily suspended due to COVID-19, but the program was able to utilize a digital EPDS form through the MotherWise website to offer screening and support for individuals remotely. Services were adapted to an appointment-based hybrid model in April 2021, and screening continued in the digital format as well as in person during office visits. Changes in screening scores for those receiving support. Repeat screening was conducted in person for participants during subsequent office appointments and remotely for those who preferred the digital screening option. Number of individuals who utilized the supports MotherWise offers. MotherWise set a goal of serving 1,000 plus individuals. This goal was met as the program served 1,414 individuals during the 2021 fiscal year. MotherWise also set a goal of serving 350 perinatal individuals with specialized support, and this goal was met as well as the program was able to serve 492 participants in this category. Description of the evaluation methodology. Staff delivered simple evaluation questions in the preferred language of the participant and with word choice that was appropriate for their apparent level of understanding. Whenever possible, the evaluator was a team member who had rapport with the family. Staff administered and tracked the following: perinatal mental health screening with EPDS. Pre- and post-screenings were conducted before and regularly after program supports were in place by trained team members at key locations. Number of individuals who utilized supports. The program administrator ensured that each individual who engaged with the program was logged, and the totals were calculated at the end of the fiscal year. Number of individuals who report feeling better supported. Pre- and post surveys were given at the beginning and end of program participation. Outcomes were compiled and analyzed on an annual and semi-annual basis.